Hi everyone, this is Miri, your friend on a quest for health and longevity. In this video, I'll be sharing the results from my follow-up consultation with Dr. Hisham after undergoing thorough longevity tests. We'll dive into what these results mean for my health and how they can help me and you to optimize your health and slow down aging. I invite you to see what I've learned and discuss why these insights go far beyond regular checkups. If you have not watched the first part of this video, the link to the video is here. There is also a third part to this video in which I share how I have successfully reversed some of my health risks. Do take a look.
I can feel my menopause is coming to me soon. I can feel it.
So, the health optimization plan is simple, okay? It doesn't look that simple here.
I do know I need to do more exercises. You have given me very clear requirement on how many times, but this looks really high.
Few months.
师傅. Hi friends, we are back at Dr. Hisham's clinic today. I got my report back. I'm very excited. So Dr. Hisham is going to share with me the results and give me advice on what diet changes, behavioral changes I need to make, and also supplements and food changes. So are we ready?
Yes, we are. It's been about a week since we last saw each other.
Yes.
And now we have the results. Right?
Very comprehensive tests.
Yes, yes. So the first thing is that the lipid profile is something that we need to work on.
Okay.
All right, okay. Diabetic profile is fine, okay. And there are certain things in the cardiac profile that we need to also work on. Current cardiac risk, okay, in terms of biomarkers, that's actually low. But the risk of developing cardiac disease, okay, is there. There's one thing that I added on. It's called lipoprotein A, LPA. Okay, lipoprotein A is actually a good marker to show if it's high, then you have a higher risk of having cardiac issues. All right? Okay. Yours is within the normal range, but as I mentioned just now, your total cholesterol is high. Your LDL cholesterol is high.
Super high.
Yeah. Yeah. Your apolipoprotein is 1.18, okay, grams per deciliter. Okay, it's within normal range. But what we want for ApoB to be is around 80.
Okay.
Around 80. So we have a bit of work to do there.
Okay.
Okay.
Is it correct that if ApoB is high, the chances of having clogged arteries are higher?
Over time, yes.
Over
okay,
time.
so a lot of people, they focus on LDL cholesterol. Okay, true, we should focus on that, but ApoB is a better marker. Okay, so I focus on ApoB and bring it down to around the range of about 80. Okay. Some of my patients, they want it to be about 60. Okay, yeah, and then we work towards that. Okay, it can be done. All right. Okay. You also requested for autoimmune markers, and those are all normal. Okay. All right. Thyroid is also perfect. Tumor markers. So we looked at basically your liver, your colon, ovaries, breast, pancreas, and nasopharyngeal, and those are all normal.
It's very comprehensive. Yeah.
Right. Okay. Homocysteine is something that we will need to work on as well. Homocysteine is a protein. Studies have shown that if you have elevated homocysteine, then you at risk of developing chronic disease.
Do I have elevated homocysteine?
It's on the higher side. It's actually within normal range, but it's on the higher side. Okay.
What kinds of diseases can develop?
So, cardiac disease or metabolic disease, such as diabetes. Your ESR is on the higher side. ESR is inflammation.
Really?
Yeah, in the body, okay, it's on the higher side of normal, okay, and we'll need to watch that as well. It's probably due to all the things that's going on that's causing inflammation inside your body.
Oh.
Okay. Like your cardiac markers and everything else. All right. Okay. Metabolic health is fine, okay, but of course, with cardiovascular risks being increased, we need to ensure that the insulin levels, the glucose levels, the HbA1c remains low. Okay.
can feel my menopause is coming to me soon. I can feel it, but wouldn't
everything looks
understand.
normal, right? But
Yeah.
when you analyze it, yes, I think what you're feeling may be true.
Oh.
Okay, yeah. So, but you also mentioned to me that you were stressed, right?
Yes, very
You're
stressed.
very stressed, and things like that. It doesn't show in the hormones, okay? But what we usually do is we track the hormones over time, okay, and see whether the cortisol or testosterone and things like that they fluctuate or go up and go down. Now, in terms of hormonal balance, okay, the analysis shows that you are transitioned towards the M.
Okay, yeah. It's
Okay.
just normal, right? My age.
Well,
I want to delay it though.
yeah, well, we can work towards that. We need to monitor this because make sure that, and again, maybe in 3 months' time, we do another hormone test. So, about bone health. So, vitamin D is sufficient, okay? But I think what we need to do is optimize it further. And because you're taking 8,000 IU, I would suggest that we test it again in about, say, 2 or 3 months,
Okay.
all right, to make sure that it doesn't fly up, go really high, okay?
It is great to hear from you like that, because usually when we go to a normal body check, they will just say, good, because it didn't cross the line, right?
Yeah,
they
yeah.
wouldn't be telling you that in the future there would be a risk if you don't
Oh, no.
change.
So for myself, this is not about detecting disease, right, or early disease. This is about preventing disease from happening. So there's no point in waiting for it to cross the line. So the health optimization plan is simple, okay? It doesn't look that simple here, but yeah, okay. But it is, in a way, simple.
But I do appreciate it, because I do know I need to do more exercise, especially cardio and strength training. But you have given me very clear requirement on how many times. But this looks really high.
Yeah, it's which is why I also made a little table, which I will then share with you via link that you can input and I can track you.
Oh,
Okay, for the next few months.
师傅.
Okay, so exercise, 4 to 5 times per week, okay? On compound movements, strength training, okay, is for you 4 to 5 times a week, okay? Squats, deadlifts, and we'll work on the specifics, all right? Okay, because what you need to do is strengthen the joints and the bones so that your vitamin D actually gets absorbed better.
Okay.
Right? In a few months' time, we'll also do an in-body, make sure your muscle mass is going up and then your body fat mass percentage is going down.
Yeah, okay.
Okay? Cardio, all right? Okay. 3 to 4 times per week of moderate intensity cardio. Okay, jogging, cycling, swimming for about 30 to 45 minutes. Okay. High intensity interval training is only once a week. For you, I think we need to build the cardio, all right?
Yes.
Okay, to reduce the cardiac risk, right?
Okay.
Protein intake, okay, should be about 1.2 to 1.6 grams per kilogram body weight per day.
And does it matter what kind of protein, animal protein, plant protein?
So I would say, okay, a balance of both, right? Okay, and if it's animal protein, it'll be more towards like white meat and fish.
Okay.
All right?
Okay, all right.
And then carbohydrates and fats, right? Okay, so I think what we need to do is incorporate the healthy fats like avocados, nuts, the fatty fish, right? Like salmon into your diet, right? And take away the beef and the pork.
I feel so embarrassed because in my channel I talk about all these things and I'm not good at practicing them myself.
It's okay. So for carbohydrates as well, okay, our staple diet here in Asia is rice, right? Okay, so we have white rice, okay, and there's different kinds of white rice as well. Okay, you need to look at the glycemic index. Incorporate brown rice or red rice into the food.
Nowadays I actually eat very little carbs.
Okay.
Yeah,
cool.
I try to reduce my carb intake.
So it's about portion control. It's not about kind of like cutting down everything or not eating everything. Now, supplements, okay, I know that you're on a lot of supplements.
Yes.
Okay, and I've looked at that. Okay, so actually it's not bad, right? Okay, but for you, I think omega-3
Yes.
Fatty acids, okay, to lower the cardiovascular risk. You're on vitamin D already.
Yes, I am.
So we continue on that. Okay. Now, homocysteine is not just exercise and diet and good sleep and things like that. Okay, but it's about vitamin B6, B12.
Oh.
So vitamin B. So you may want to incorporate that, or foods that are high in the vitamin B. Magnesium to support cardiovascular and metabolic health as well.
Yes, which I'm taking
Yeah.
now.
Cool. So that's that, right? Okay. The other thing that you may want to do is also aim for 7 to 8 hours quality sleep.
I can't. I think my hormones are affecting me. Yeah, I wake up 2-3 times a night, especially the week before my period.
Yeah.
Yeah, I'm so affected by this.
Okay. So then we need to monitor the hormones and we need to work on that, right?
Okay.
Because sleep is very important to rest the body, okay? To reset everything, okay? Do you practice mindfulness, stress reduction?
I talk a lot about it, but I need to work on it. I need to learn how to practice it.
Mindfulness is and meditation is important, especially in a place like Singapore or even other cities in Asia where everybody's stressed, right?
Yeah.
Yeah. You need to reflect and kind of be grateful about what you have and then kind of like reset yourself. Okay, so but yes, it's not easy to do, so you need to do this about 10 to 15 minutes per day, right?
You also mentioned that stress has something to do with those markers.
Yeah.
Because as you know, last year I was full-time, like I wasn't having any rest. I was taking care of my late mother, and her passing really caused me a lot of stress and grief.
Stress is one of the contributing factors towards unhealthy lifestyles, right? Which then contributes to health risk factors. Stress induces stress hormones, which also affects the body as well.
Yes.
Right? So it's not uncommon in Singapore for people to have suddenly normal biomarkers, then suddenly in 1 year or 2 years suddenly elevated up.
Right.
But it's something that we can mitigate and prevent and control. So daily tracking table is here.
Oh, wow.
Right, and I've also provided a kind of a template of what you need to do daily and weekly, next 3 months and next 6 months, in order to reduce the risk of all these other diseases from happening. Okay.
My small size jeans, they're excited. They're waiting for me to put them on again.
We can do that. Okay, we can do that. Next 3 months, the goal will be, continue on the prescribed exercise, nutrition, all these things. We may want to redo just the lipid profile, the glucose profile, including insulin, ApoB, and then the homocysteine. We'll look at basically the hormones as well. Now, in the next 6 months, because of the cardiac risk, right, we'll look at a carotid intima media thickness. Okay, that's an ultrasound scan to look at your carotid arteries and how thick the lining is.
Oh, okay.
All right, okay. And this actually shows you your risk of cardiac disease, a vascular disease, I would say, outside of the heart. In the heart itself, so what I would suggest is basically do a calcium score, CT calcium score, or CT angio, to look at cardiac risk itself. So DEXA scan, have you done one before?
No, I haven't.
Yeah, a DEXA scan to look at basically the bones, the visceral fat, the muscles and everything else. But I think for all of these, we need to work on optimizing it first.
Yes, I think so.
And then beforehand.
See if I can reverse the problem.
Yeah. Last but not least, to do a VO2 max. VO2 max is where you run, and then we look at how much oxygen is consumed.
Yes.
And things like that.
I do know my cardiac, health is not so good. Like my lung capacity and everything, because I really dislike running.
So we don't have to do that now, okay? Where we optimize everything first, and then we
Okay.
we'll work on it. Because the thing is, if we do it now, okay, yeah, I can tell you the VO2 max you probably fail, okay? Yeah, because you're not used to running.
My watch says my VO2 max is good. For my age, it's normal.
Okay.
It's not optimal, I can say.
Yeah.
But I don't cross any lines.
Okay. What we don't want is just normal. We want it to
Okay.
be optimal. Okay. Right. So we'll work on this. All right. So I know that you were excited when I showed you your results earlier because it was like normal, but the analysis is a better indicator for this.
Everything points to the same thing. Yeah, better diet, better sleep, manage the hormones, but most of all is more exercise. Everything points to that.
Yes.
Yeah, and also the thing is, I would think that my problem is very common among people my age. And you cannot see, because outside I look normal, kind of like a bit chubby, but I look normal, but inside what's going on is not optimal.
Yeah, so it's not just 40-odd-year-olds, okay, or 50-odd-year-olds that I see this in. I'm starting to see this in 30-odd-year-olds, okay.
So how much does genetics play in this?
Not a lot, actually. So a lot of people blame their genes, right? Okay, so they are genes that affect us, right? Okay, but and they contribute to about 20 to 30%, right? Okay, just not that much of the outcome. Okay, but what's more important is that some of these genes can be switched on and off. It's called epigenetics, right? So can be switched on and off. So through lifestyle modifications. So if we optimize the lifestyle, okay, which then contributes to about 70 to 80% of the outcome, right? Okay, we can actually subdue those genes. We can do that, okay, we can do that.
I hope that my sharing so far on longevity health checks has been helpful. I'm truly grateful to have Dr. Hisham working closely with me to monitor my health in such detail. If you're interested in consulting with him, feel free to reach out to me and I'll help you forward your booking. Or you can also email his clinic to directly book an appointment. As a special offer for my viewers, you can enjoy a 10% discount on consultations until the end of year by using the coupon code MIRI10 when booking. Don't miss this opportunity to take control of your health before the new year comes. Knowing about our health risks is just the first step. Please go and check out my third video about how I have successfully reversed some of these health risks and lowered my inflammation markers in just 3 months. Be sure to check it out as well.
Hello, welcome to Bartley Clinic. Please follow my TikTok. We can do that, okay, we can do that.